Hello and Jai Hind to all viewers. Welcome back to Sunvaad, the student-led podcast platform where students come forward to ask meaningful questions and learn from people whose journeys inspire us. I am Gautam Gokhale and I am truly grateful to be given the opportunity to host today's episode of Sunvaad. Today it is my privilege to have with us Dr. Subodh Kumar Pathak, an orthopedic surgeon practicing here in Varanasi. Sir holds qualifications including Master of Surgery, Diplomat of National Board and Diploma in Orthopedics. He is currently working at Sparsh Orthopedic Care, Bhujubir, where he is known for his patient-centric and evidence-based approach to orthopedics care. Orthopedics plays an essential role in our everyday student life. It affects how we sit for long study hours, how we walk, how we play sports, or even how we use our mobiles. What makes today's discussion even more meaningful is that beyond the discussions and beyond the operation theatre, Sir strongly believes in fitness, regular movement, and prevention as the foundation of long-term bone and joint health. He is also a keen follower of cricket and has a thoughtful interest in public health and social responsibility. Sir, we are truly grateful to have your presence with us today.
Thank you.
Welcome to Sunvaad.
Thank you.
Yeah. Now let's move to the first question. When you look at your journey from a student till an experienced surgeon, what has been the most difficult phase of your life? At that time, did you ever feel confused or uncertain about your future? And how did that shape you as a person?
No, yes, confusion in like the generation what we are in living in today, 2025. So you must be 8, 10, 15, 12 years, the teenaging. During our time, we were not exposed to so much of social media, so career opportunities were limited. We knew what we want to do, but there were limited options to be done. Yes. So either you go in civil services, either you become a doctor, you become an engineer, and limited. Everyone been knowing this. So yes, I knew that I had to take this career path. As a doctor, I knew, but as a surgeon, that decision was made later in my life after my finishing my MBBS. Yes, but I really enjoyed the journey of becoming a doctor and then becoming a surgeon and then practicing, because this is all giving away to the public what we got for so many years. So yeah, I really enjoyed this journey.
Okay, sir. That's really insightful. And now this all must have shaped how you handle pressure in the operation room. So as a surgeon, many of your cases may involve accidents and emergencies where quick decisions may be life-changing. So how do you train yourself to stay calm and focused, and what mindset separates a good doctor from a great one?
So yes, decision making in the theatre is always challenging, especially in cases of trauma, in cases where you have to take a call that, okay, I have to do this or I have to do that, which might change the whole, it's not life. I'm not talking about, okay, living, not living, or not that. One small decision can change the whole way the patient in future walks, or how the patient sits, or how the patient performs his activities. So that decision making, it's a due that thing of making a quick decisions that you learn in your way, becoming an MSI or becoming a surgeon. And yes, how does a person stay calm in the theatre? One thing is that a regular exercises for me, it's a big boost for me. Second, music is a big boost. I enjoy listening to music in theatre. Sometimes we listen to music also in theatre to stay calm. And it's a light music, and we really enjoy. Even sometimes we talk to the patients. Like when the patient is awake, when we are operating on the lower limb, the patient not on the general anesthesia, we talk to the patient, and that all things make us stay calm. Yes.
Thank you, sir. Now, let's move to a more relatable and medical point. Many students sit for long hours, use mobiles and tabs without even exercising much. From an orthopedic perspective, which habits should they immediately change to avoid long-term problems?
So long-term problems can be avoided. One thing is the screen time. Screen time is very, I know people using 6 hours, 8 hours, 10 hours, 12 hours of screen. And that's really detrimental in long term. And physical education is one thing which should be focused on. And I think Sunbeam, I've seen while coming to this podcast room, I saw the whole ground full with students. So I was really happy to see all the students playing, flying kites, and then playing all types of impact games. So one thing is sitting for long hours I don't think so any school promotes that. Any like the periods are small, like 40-45 minutes, 1 hour maximum. So long hour sitting is again difficult, because after long hour sitting, what happens, your back muscles, you start getting pain in your back, then you start getting pain in your legs. So long hour sitting is always not very good, even in adults. Children is one thing, even for adults, for working in offices, it's not good. And one thing what I feel is physical education should be emphasized more, because that is what your bone health will be because you gain bone till your age of 30-35. After that you have to lose it slowly. So the more you gain, the more you have, the more is there to lose. So physical education mein what you have is regular exercises, then good diet, then playing impact sports like playing jumping, then you have all. And if you continued with your physical education, sports related injuries becomes less. Otherwise your stiff body can always get traumatic injuries.
Yes, sir. Thank you, sir, for that knowledge. It was really helpful. Now that brings us to another similar question. Many people tend to visit a doctor only when they experience immense pain or discomfort. From your perspective, why is focusing on prevention more important than focusing on treatment?
Prevention, because focusing on prevention is more important. One thing, see, in if you talk about India now, vitamin D deficiency is a big thing in India now. Like it's highly prevalent. I wouldn't be wrong in saying that almost 50% people are deficient in vitamin D. 50%, that's a big number, half of the population, or maybe a bit less. But the figures I'm quoting is from a good journals. So that includes children as well. So if you see in schools, in tier 2, tier 3 cities, the numbers might change. In the West, the numbers might, but if you are focusing on India, why prevention I'm talking about is important, because vitamin D deficiency gives you generalized body pain. You ask the child to play, he won't be interested, because he knows once he starts playing, he'll get that body pain. So he's not interested, but he's not telling anyone, because he's like, people are like, he's lazy, he's not playing. But you have to focus. Why is he not playing? Is he not interested? Or if he's interested in playing in one type of sport, that is understood. Okay, he likes that sport. But if he's not interested in playing any sports, he's like, I'll sit and watch. So that has to raise an alarm in the school. Like, why the child is not interested? Like many a times I've seen students like not interested in sports. So one thing is that population has to be screened for vitamin D. That has to be screened for nutritional rickets. There is a rickets. There is a term known as rickets, which means low vitamin D, the softening of the bones in children. And that's common in children. Like these children have some, you must be knowing, knock knees, bowing of legs, the legs becoming this. Then children having generalized body pain. Like they come with the school bag, and then once they are reaching the school, they're like, they have back pain. I get in my OPDs, I get children as young as 12 years, 13 years coming with back pain. So this is raising an alarm. So why prevention is important? Because we don't want this population. This is the future of the country, and we don't want that population to come with the burden of back pain and then knee pain and all that. So diet has to be focused, and in prevention, sports is number one. Diet again comes as number one, and in school has to emphasize on they should have a teaching session on what is rickets, what diseases are prevalent from the orthopedic point of view in students in that age group, and as well in teachers also. So the bright future of this country is ahead, and we don't want that bright future of the country coming with all sorts of orthopedic problems. We won't. That is the last thing we will see in the OPD.
Yes, sir. Sir, what a thoughtful answer that is. I will always remember this answer. Now, I know prevention is the key, and so I think will the viewers. Now, I have come to another deep question, which is about determination. We all know that medicine and surgery require years of effort before results are visible. So, when you were working hard, but the success felt far away, how did you stay motivated? And what advice would you give students who think that their hard work isn't paying off yet?
See, there is no shortcuts in education. There is no shortcut for success. If you're getting you are becoming successful with a very shortcut method, so that success won't last long. That is for sure. So hard work definitely pays off. See, you'll be slogging years, and then what people say are like he's studying for so many years, but result is not that. It doesn't reflect on his results. Results will come. Yes, sir. Your 6th standard, 8th standard, 10th standard, everything that also decides your career, that also decides your future. But again, the results are way ahead. It's a long life. So, when, for me personally, I'm telling, when I was giving my MS exams, when I was giving after my MBBS, when I was appearing, I didn't clear it for the first time. It was very damn difficult. It was not difficult, I would say. I missed by 7 marks. So that was like, oh, okay, now there's two ways to look at it. Okay, I missed by 7 marks. And the other way is like, it's difficult now. I cannot do it. So, but no, I studied again the next year. The next year I cracked it. And I cracked it with the better marks. So if you stay focused, luck is what people say. Like there's a saying that the harder you work, the luckier you become. That's the thing, because luck is the thing that you think he didn't study. You don't know that he didn't study. He must have studied. He didn't show it off that he's studying. So hard work pays off, and the more you study, the more you work for your, like, you know what you have to do. If might be your exams, my 6th standard, 8th standard, 10th standard, whatever exams you feel. The better you work, the results are visible. If the results are not visible in one direction, it will be visible in some other field. It won't be visible.
Yes, sir. So that is a really motivating answer. Now let's dive into a quick rapid fire round. Short and crisp answers for students to remember easily. One orthopedic problem you see increasing among young people today.
Back pain.
Okay, sir. Best daily habit for strong bones.
Exercises.
Yes, sir. Mobile phones. Biggest danger to posture, myth or reality?
Myth. The biggest danger posture, reality. Neck pain.
Yeah, okay, sir. Sports injury. Ignore or get it checked early?
Get it checked early.
Okay, sir.
And it's very preventable, sports injuries.
Yes, sir. One quality students must have to succeed in medicine.
Hard work.
Okay.
Dedication.
Yes, sir. Sure. Now that brings me to the end of this rapid fire and the concluding question. If you could give one message to your younger self and to every student watching this episode of Sunvaad, what would it be?
I would say work hard, study hard, but with studies, even enjoy your sports. But what I would say, what I regret, I would say, but like what I would have improvised in my younger days, I would have played more sports. I would have played more of because we didn't have that like in Sunbeam. What I see, sports is really a big platform. Like I've seen, even I have my younger kid here. He's hardly 4 years old, and he plays everything. He is into sports, and that thing comes from Sunbeam. I think the culture here, the sports culture here, the exercising routine here. I've seen a lot. Like the moment we enter Sunbeam for that kid, I see people playing basketball that morning hours. So I feel really good. Like I feel like even like getting and start playing with them. So one thing I would have improvised in my early school days: study. See, everyone studies. No one is here not to study. Even if you don't study, the school will make sure that you study.
Yes, sir.
And that's a big motivation even for the student, the teachers here, the principal here, the mentor here, everyone. They'll make sure that you excel in your life. But what I would say is, keep yourself with the studies, keep yourself focused towards a sports, because I've always missed all that. Like I like badminton, I like tennis, I like to go to gym, I like cricket, but we didn't have that thing in our school. So but what I see in Sunbeam, it's wonderful here, and I'm really proud as a proud parent of my child in this school. I really feel proud that he is in good hands, and he'll be getting a better shape in his coming future.
Yes, sir. Thank you so much, sir. This is really motivating. We all should have a balanced life. And thank you once again for such sharing your journey and such values with us today. To all our listeners, remember, we should stay disciplined and keep learning every day. This is Gautam Gokhale signing off from Sunvaad. Stay curious, stay motivated, and stay happy.
Thank you.
Thank you and Jai Hind.
Thank you.